Hello, if you're watching this video, then you're awaiting joint replacement surgery or have just undergone a joint replacement. Either way, this video will help you as you transition from the surgical center to your own home. We will demonstrate daily living activities with a focus on total hip precautions and safe mobility, which you will follow for at least the next 6 to 8 weeks until your doctor advises otherwise. The first area we're going to cover is total hip precautions. Whether you are having an anterior or posterior approach to your hip replacement, your doctor may have talked to you about certain movements or positions that are not allowed after surgery for up to a few months. These are called total hip precautions. These positions and movements must be avoided because the muscles are weakened after surgery and need time to heal. Until these muscles are stronger, you are at greater risk of dislocating the hip. If your doctor used an anterior approach, the hip precautions vary from no precautions at all to no external rotation and no hyperextension. As long as you avoid excessive extension beyond an average step length and be cautious not to twist on the surgical leg, letting the toe turn outwards, you should be fine. Walk slowly with your assistive device and be aware of your surroundings to avoid falls. Your doctor may have discussed a total hip replacement with posterior approach. With this approach, there are a few more precautions that you must follow. These precautions are also in place for at least 6 to 8 weeks to allow the muscles to heal and support the hip adequately to allow normal function. Your doctor will advise you as to when you no longer have to follow these precautions. The posterior hip precautions include no bending the hip past 90 degrees. No turning the leg or toe inwards. No crossing the operated leg past midline. It's very important to maintain all these hip precautions throughout your day during all activities. The following demonstrations will help you understand restrictions and help you put them to practical use. If your surgery was a total knee replacement, you may not need to follow these precautions, but the strategies for safe mobility will apply and will be of use as you return home. First, let's take a look at sit-to-stand transfers. Regardless of the type of surgery you've had or device you have been ordered to use, you should use the same or similar technique. 1. Let the surgical leg out to a comfortable distance. 2. Scoot to the edge of the chair. 3. Place your hands on the arms of the chair and your unoperated foot underneath you. 4. Push up using your hands and foot, being careful not to bend past 90 degrees at the hip, especially after a hip replacement. 5. Once you feel steady, bring your hands to the device you'll be using. 6. If you will be using crutches, you can hold both crutches in one hand, and once standing steady, you can move one crutch to the opposite arm and support your body weight by applying pressure at both hand grips. Remember, pressure should be focused through the hands. Sitting is just the reverse. 1. Approach the seat, turning with back side towards the chair. 2. Be sure you are close enough by feeling the seat touch the back of your knees. 3. When using crutches, move both crutches to the non-operated side. 4. Reach for the arms of the chair. 5. Let the operated leg slide forward slightly. 6. Lower yourself down to the seat. If the seat is too low, feel free to add a pillow so you are sure to maintain 90 degrees at the hip joint. Walking with your chosen device should be slow, and you should only put as much weight on your surgical leg that the doctor has recommended. In most cases, this will be weight bearing as tolerated, which means that you can put as much weight on your leg that you feel comfortable with. Any other weight should be shifted to the crutches. The sequence would look like this: crutches, operated foot, weight on your arms as needed, then finally the unoperated leg. Another important piece to returning home is being able to safely get into and out of your vehicle. To complete a car transfer, there are a couple of things to do before you even get into the car. Ask your caregiver to move the passenger seat back as far as it will go. You should also recline the backrest a bit. If your car is low, a pillow may be necessary on the seat to elevate the sitting surface so you make sure you don't bend your hip beyond the 90 degrees. When you are safely in the passenger seat, you can adjust the seat as needed. The transfer would go like this. First, approach the car, turning with backside facing the passenger seat. Then, extend the leg outward. Place the hands on the dash and on the seat or car frame. 3. Bend back to sit on the seat, always being careful not to bend past 90 degrees or let your toes turn inward. 4. When bringing your legs into the car, remember those hip precautions. You must be sure to avoid bringing your leg past midline, and you must avoid internal rotation, which is turning your knee or foot inwards. 5. Once seated, you may adjust the seat to your comfort. Oh, and one more thing, don't forget your seatbelt. Many of you will be returning home to at least a few stairs. Safely getting up and down those stairs is really very simple. Once you can do one step, the rest can be completed by using the same sequence. The sequence looks like this. Line up close to the bottom step with one hand on the rail and one hand on the crutch. If you have two railings, the crutches should be moved to the opposite side from your surgery and then hold the railing with your other hand. If you only have one railing, just place the crutches on the side opposite of the railing. You will step up with the unoperated leg first, pushing off the crutch. Then bring the operated leg up, followed by the crutch. Stairs should be completed one at a time, repeating the process we just demonstrated. When going down the stairs, the process is the same, but opposite. Line up at the top step, hand on the rail, and device at your side. If the rail is located on the wrong side, just move the device to the other side so as to allow you to grasp the rail with your hand. Advance the crutch to the first step below and follow with your operated leg. Remember, if you're not able to tolerate full weight on your leg, you can press down through the crutch to help you absorb some of the pressure as you step down. Finally, bring down the good foot. Follow the same sequence for all remaining steps, and remember to only complete one step at a time. Once you're home, it's important that you're comfortable. Laying on your back with the surgical leg elevated is usually the most comfortable position. It promotes circulation and minimizes swelling. When the lower extremity is placed on a pillow, be sure the knee and calf are supported and that the heel is just over the edge to prevent skin breakdown. Proper positioning should look like this. The bed transfer would look like this. Use the same sitting technique that was demonstrated earlier. Use your strong leg and arms to scoot back onto the bed. When you're back far enough, lift the good leg onto the bed. Next, lift your surgical leg onto the bed. If you need help, you can use your strong leg to assist. Be sure that you lean back and avoid turning the leg inwards or crossing midline as you complete this transfer. The operated leg may need some assistance in the first few days after surgery. There are several assistive devices on the market geared toward helping you move safely and more easily as you recover from your surgery. They can be purchased at local medical supply stores. The reacher and long handle shoehorn will help you maintain those total hip precautions as you put on your shoes and socks. Another hint, when dressing, always dress the surgical leg first. Then you can manipulate the good leg as needed to complete the task. Thank you for watching our video. Remember that one of our physical therapists will be in touch to schedule your first home visit after surgery. Good luck, and we'll see you then.